Hey guys, welcome to another Respiratory 3260 video. This video specifically is to talk about different types of resuscitators you might see. And in this video we're going to show you 4 along with different masks and to show you how to change the pressures during active resuscitations. So as I begin all my videos, we're going to go over the equipment for lab. We are going to cover the Neot and the accessories associated with it. The Neot, which is similar but kind of a more portable version of the Neot. We are going to show you a neonatal flow inflating bag and a pediatric flow inflating bag. So we're going to cover all of those. We're going to start with the Neot. So for all of these resuscitators, you need a gas source attached to a blender. If you're in an emergency and all you have is a tank available, that's also appropriate if you're in an emergent situation. But say you need to use one of these resuscitation devices when changing modalities or maybe moving a patient, something like that, you want to make sure you have the blender so that you give appropriate oxygenation as your patient needs. So you need a 15-liter flow meter because every single one of these devices use 10 liters of flow. And then, as we talked about in our oxygen therapy video, we use the blender to change the FiO2 we are delivering to our patient. So for these, I'm just going to start from the wall and move out to show you guys how it works. So we have our 15-liter flow meter where we can deliver 10 liters of oxygen. We then attach just some normal oxygen tubing, extension tubing, which attaches to this specific adapter for the Neot. You might call it here called a gas inlet nipple or a Neot adapter. So the oxygen will connect to this adapter, and then we'll attach the gas inlet port right here. So now that we're here, this will attach here. Let's go over the different features of the Neot. Over there. So over here is our manometer, which tells us what pressures we are delivering. So a few things with the Neot is you can give a consistent volume and a consistent pressure because you'll set them in the Neot, but you might not be able to get an immediate readback of what the patient is doing and patient compliance. So that's kind of the trade-off between flow inflating and Neot systems is Neot, you give uniform volumes, uniform pressures, where the flow inflating, it might have some variability in your volumes and pressures you're giving, but you'll be able to get instant feedback from your patient to feel compliance, maybe secretions for assessment. So, and then the other thing is they're both equal. It's honestly, my opinion is the best resuscitation device is the one you're most comfortable with using. And a lot of it is whatever your facility provides for you. So that's my 2 cents on the subject. The best resuscitation device is whatever you're most comfortable with using to help your patients the very best. So, off that soapbox, let's get back to the Neot. So we have our manometer to check what pressures we give. Per NRP, we start at a pressure of 25 centimeters water pressure over 5 centimeters water pressure. So that is our PIP is at 25 and our PEEP is at 5. That's just starting out. You can definitely adjust via Mr. SOPA or whatever your patient needs. But that's just a good baseline starting point, and then adjust as what your patient needs, except don't go below 5 on your PEEP. You've all been warned. Right here is the pop-off valve, which what it does is it helps prevent, you'll set it, most of the time we set it at 40. 40 is a pretty normal pop-off for resuscitation devices, so that as if we are increasing pressures up and up and up, we will not go above 40 because it will dump the breath and the pressure so that we don't potentially cause a pneumothorax or excessive barotrauma. We have a gas outlet if for some reason there's continuous pressure or flow building up inside our Neopuff. And then this dial is where we adjust peak inspiratory pressure. Oh, excuse me, I'm an idiot. The gas outlet attaches to our circuit. Don't worry, I've only set up about 100 of these. Attaches here, to which then we come to our adapter, and it is this twist knob that we change our PEEP, and we will include, and I'll show you guys how to set that. This end of the adapter is where we'll attach our masks, which we have varying size depending on your patient. So we can have infant, neonate, preemie, which is just little. And then there's varying pediatric sizes, or if you were working in a pediatric hospital. So we'll just use our infant mask, and it attaches here. Okay, so I'll show you guys how to set and calibrate it. You will set your blender to whatever FiO2 you want to deliver. Increase your flow to 10. So when I'm setting the pop-off, first thing I do with the pop-off is I bring my peak inspiratory pressure all the way up. Then I'll include, sometimes I'll take the mask off because you don't want to do the pressure while holding the mask, because it will give you the pressure, but it will also cause a leak, which makes it give you inaccurate pressures. So either put your thumb in and block at the port, or else I'll just take it off and I'll block with my hand and then my finger. So when you block just this end, the main opening end, that will give you your PEEP. If you block both, that will give you your PIP. Okay, so I'm gonna move this cover, and this cover is put here purely so that the pop-off, it's a backup safety feature, so it doesn't get adjusted, get bumped. Maybe during a stressful resuscitation, somebody twists the pop-off instead of the PIP. So we'll move this. I'll block both my PEEP and my PIP after bringing my peak inspiratory pressure all the way up. And I can see I can adjust my pop-off to whatever pressure I want. So we're going to go to 40. After that, I'm going to cover this up because now I know it's safe. After that, I adjust my peak inspiratory pressure because I'm already occluding my circuit. So I'll just turn my dial down. You can see what I'm doing. And it might take a minute. Down to our 25. Or 26/6. It goes by twos. That's just verbinology. Okay. After I'm happy with where my PIP is set, I will let go of this port and just occlude for PEEP. And then I'll see where the dial down here is, and I will adjust my PEEP to where I want it. And you see as I twist, the dial changes. So you'll put that on 5 to start out. After that, you are good to go. Those pressures will remain consistent, and everything's set on your Neopuff. After that, if you need to, to resuscitate, to deliver a positive pressure breath, it will sound like this. You'll hear that whistle if you're giving PEEP. And then this is what it'll sound like when you deliver a breath. And watch the manometer while I do this. Alright, so that is the Neopuff. Now we are going to discuss the Neot. Okay, the Neot is a more portable version of the Neopuff. It is set up pretty similarly, but it can be a little tricky and intimidating to use. So the first thing I've noticed, just in my experience, is make sure all your connections, especially this one, are nice and tight, because sometimes things get a little loose and cause a leak. So to break it down, we have our manometer here that will read us our pressures. We have our PIP outlet for delivering breasts, but also our PEEP adjustment side to side. This is just a little cap you can use if you need to check your pressure, and it also just is there to keep it clean before. And then we come down and we have this piece that we adjust our PIP based off of, and then we have a pop-off. If for some reason you need to override the pop-off, which honestly is just a really bad day at work, you can push it down, which it will automatically set to 40 centimeters of water pressure for the pop-off. And I'll show you guys how this comes into play. And then we have our oxygen tubing. The Neot also connects to a 15-liter flow meter. And then we have also our blender. We go up to 10 liters of oxygen. So with the Neot, if it is brand new, you will always set your PIP before your PEEP. Remember that if you're having struggles with it, always set your PIP before your PEEP. So before I do anything else, this is not the most technical thing, but to get us to that 25/5, there is a little arrow in here. It's kind of hard to see. I bring it to the middle of medium. See how that is there? It will bring us a little bit higher on our manometer, but then we can adjust. So then I check my manometer, and it's occluded with this cap. And then I'll occlude the top. As you can see, we're at 30. So how I bring that down is I bring down this dial to 25/5. So I'll bring this down till I'm that 25 of PIP. And then that will stay consistent. After that, I will adjust my PEEP. So as you can, let me hold it upside down. I'm sorry, guys. After my PIP is set, I can turn my PEEP dial to the PEEP I want. After that, you can remove the cap and attach whatever mask is appropriate for your baby. That is Neot. It is a little tricky the first couple times you set it up, I will be honest. So make sure you play with it and adjust the pressures. But it is really handy once you get used to it. Okay, so that's the Neopuff and the Neot. They're kind of the siblings of these certain type of resuscitation devices. The next one I'm going to show you is the neonatal flow inflating bag. So let me show you the parts. This is a 500 ml bag. That's the volume of this balloon. We have our 40 centimeters of water pop off. If for some reason you need to block that, you can use this cap. But again, that's a bad day at work if you have to go above 40 centimeters water pressure. You can put an additional manometer here if you want. Over here is where you will adjust your PEEP, this little valve, and I'll show you guys. Up here is our manometer, and then our oxygen tubing out. And then finally, this port is where you would apply a mask. Same as with the Neopuff and the Neot, you don't want to set your pressures with a mask on. You either want to reach your thumb in and occlude, or use your wrist to occlude. The thing I find most difficult with the flow inflating is finding the right way to hold it, to set your pressures and a bag. So I found what works for me is I use my hand here, and then I kind of grab onto this little port holding my oxygen tubing here. I can just kind of curl my fingers around. It's one of the harder parts. So we will get our 15-liter flow meter, plug it in, go up to 10 liters of flow, and set our FiO2. As you can see, we're already starting to inflate. So to do this, we will hold and occlude. Then you can see our manometer's kind of big. Then we will use this dial to go down to whatever PEEP we want. And then when you bag, you can see what pressures you're delivering. And it might be varying, but that might be what your patient needs to do. And then you can also watch as they breathe on their own if you want for this. You can also do that on the Neopuff with watching the manometer. A couple things, sometimes you lose a little bit of pressure. And that's just check your closures, check your adapters. And this can be pretty sensitive how you adjust your pressures. So just be cautious and conscientious about that. After you find what pressures and volumes you want on your PEEP and your flow, this is where you would attach the mask to provide positive pressure ventilation. Okay. And the last one is the pediatric flow inflating bag. So it looks similar, a couple little changes. This holds 1 liter of air, so you'll have 1 liter of volume. This inlet right here is where the flow enters and how you adjust, and the style is how you adjust your pressures. It has a manometer attached to it, and then we have our flow. And then this port out here is where you would attach your mask. So we'd have our pediatric size mask. Just stick it on. Again, if you're setting your pressures, don't do it with the mask on. Take your oxygen tubing connected. Bring your flow up to 10. You see we are having our flow going. Occlude. And then you would adjust this. Sometimes you have to cover this hole a little bit. And then we can bring it up and down to adjust our PEEP. So let's bring it down to about 5. We go by that black line in there. See how you can go up and down? So just be careful. So we'll set it at, we'll just bring it up a little bit, 8, so you guys can see. And then as you bag your patient, your kiddo, you can see we have the manometer go up to deliver the pressures we want. If for some reason you need higher pressures, you can either occlude this hole or go up with your dial if we need higher pressures. Okay, so that is the Neopuff, Neot, neonatal flow inflating bag, and the pediatric flow inflating bag. There are also small self-inflating bags. They're similar to what you guys have used before, just on a smaller basis. If I can find one, I will show you guys in another video. I guess come to lab, ask lots of questions. The biggest thing I want to tell you guys is to these are life-saving. I know we say resuscitation and we're like, oh, they're handy. With pediatrics and neonates, ventilation is key. Ventilation is how we save lives. I have very rarely seen any type of compression or anything like that, but if you can get ventilating and you can get an airway, you will save the baby's life. So that is my biggest thing, is make sure you understand your equipment, where you're working, that you're comfortable with it, and you get comfortable holding the mask will work for you. So like for me, I found I like to hold thumb and pointer finger, thumb at the top, pointer finger at the bottom, sometimes a second if I have a bigger kid, and then I'll use my last 2 fingers, or sometimes in the middle, whatever's comfortable with a kid, depending on how chunky they are, and I will use that to give a jaw thrust. So practice that, and you guys were on your way. Okay, good job, guys. We'll see you in lab.